So hello everyone, I'm Shanna. I'm a Canadian medical student, and on this channel we are making different videos to share pre-med advice, showcase different medical journeys, and hopefully give some inspiration and encouragement and positivity. And today we have Wendy. I am so thankful for her to take the time out to chat with us and share her journey. She first did pharmacy school, and now she got accepted to medical school. So congrats to Wendy, and thank you for being here. So I guess first off, Wendy, can you tell us broadly how your timeline to kind of from undergrad to pharmacy school to med school went?
Everyone, my name is Wendy. I should say first I went to UBC, did 2 years of the microbiology program there, and then decided to transfer over to pharmacy for 3 years. And in my transition, so like in the summer of third year, I found out that I was going to medicine. So I decided to transfer my program from pharmacy to med.
What made you decide to do microbiology first, like for your undergrad degree?
There wasn't especially anything clinical that you could do as a major in undergrad. So I tried to do something that was more pertaining to research. And so I decided to pursue microbiology.
Was there any moments or experiences that really kind of solidified your interest in medicine?
Between second year to third year of microbiology is when you start really specializing into microbiology courses. And that was a time when I started to question myself. I was unsure about my potential after I graduated. Was I going to work in a lab my whole life? And although I knew I was eventually going to apply to medicine, I didn't know if I could do it right away. And so I knew that, if I wanted to work a little bit first, was I suited to working in a lab? If I was going to pursue medicine anyways, I might as well try out something that's a little bit more clinical and patient focused. Mm-hmm. And this was during a time where I started exploring other majors. I actually had a very good friend at the time whose brother was a pharmacist. And I thought, they recently switched over the Bachelor of Pharmacy to the PharmD program, which is a Doctor of Pharmacy. And now the program boasts an expanded scope of practice for all the students that graduate. There's so many things that you can do as a pharmacist. So I decided to take the chance and apply. It just so happened that microbio's prereqs fit really well with pharmacies. So it's a very last minute decision, but I made it.
Was there anything that made you almost hesitate not to apply to pharmacy?
At the time, I was also applying for microbiology co-op, contemplating between co-op and pharmacy. Coming from, a family with a healthcare background, we do understand the value of drugs in healthcare and the knowledge about them. It's an important role in medicine. And I feel like medicine and pharmacy ultimately are very closely related. So if I learned early on, all the different drugs, then I think that could help me further on my career.
That the knowledge that you learn in pharmacy school will definitely be super useful. You guys do all these things like OSCEs and actual clinical skills. I think these are things that will definitely give you a leg up. If you were to go back in time, knowing everything you know now, what would you have said to the you that was making that choice to make the switch from microbiology to pharmacy?
Stop being so wishy-washy, just apply. I think I had a great time in pharmacy. Honestly, I think the friends and there was actually one good friend of mine that was from undergrad and that came along with me into pharmacy, and we're all still really good friends today. Same thing with Jamie. I wouldn't have been able to study with her for so many years if I didn't decide to go into pharmacy as well. So I think overall it was a great decision. I wouldn't give them any different advice from now.
So since pharmacy school is a professional school, is it harder to achieve a high GPA compared to a Bachelor of Science?
Like any professional program, pharmacy has a lot more of an intensive schedule, and you really do have to keep things on top, be on top of things to not fall behind. So just to give you a general idea, we'll basically have 8 to 5 p.m. classes. Some of them could be labs, some of them could be lectures for 4 days of the week, and then you have 1 day off. So that 1 day depends on which year that you are in. And so I think in first year, many of us really did struggle with the speed of the learning and the exams. For example, in undergrad, you might be only used to doing midterms and finals. Yeah. But in pharmacy, you will basically have an exam every 2 weeks on top of preparing for labs and lab exams as well in between those 2 weeks. So it's just high speed of learning. You have to memorize everything. And obviously, it felt like going through first year university again. But I don't think I don't think it's impossible to do well. I have many friends that have an average that's greater than 90%. And there's actually an honors fraternity in in pharmacy called rokai. And so literally it only comes down to your ability to memorize and to retain info. Like personally, my average stayed the same from undergrad, which from 87, 86%. So I think, it's definitely possible to be able to still do well as long as you're able to keep a tight schedule of yourself. Yeah, I think that's like, if you want to achieve a high GPA, I think you should also be able to balance your extracurriculars. Don't like think that you have to spend all of your time on studying, because you do have time to dedicate to other things. But there's just generally less time than in other undergrad programs. It's true.
Mm-hmm. That balance of doing like extracurriculars like during pharmacy school, like what were you able to kind of take on?
For pharmacy especially, I would say in the first semester is kind of tough, because they try to throw a whole bunch of stuff at you. It's all basic general things, from like basic anatomy, basic pharmacology, but it's tough because you're getting used to a new environment, new schedule. I would say definitely don't overpack your first semester, even though all the clubs are there. Like only do the things that you have time to commit to.
Mm-hmm.
In second semester, some people find it a little bit harder because then you start learning like specific conditions and therapies for them. So it becomes a lot more focused, but then there's, another beast in itself, like trying to memorize all the different drugs. So I would say for balancing extracurriculars, like think about how much time that you generally need to study. Each person is different. I would say when I was going through first year, I did I didn't really skip class. So I went to all the lectures and labs. I worked 1 day a week, and then I really needed that last day to study. And that 1 day off was like my 1 day where I could decide what I want to do. So plan accordingly. It's not going to be like undergrad anymore where you can take on a whole bunch of volunteering things. Yeah.
Mm-hmm. I think that's a really good principle. I don't know if you were ever similar in undergrad, but I like definitely had a phase or a semester where I was like, let's do all the things. Every single day will be a thing. I think your principle, and I'm trying to adopt this now that I'm in med school, is to like learn to have a day that's dedicated to your study catch up. And then also hopefully an evening or an afternoon, depending on when you like to hang out with your friends, like a day for whatever is self-care for you, whether or not that's socializing or potatoing, as we were talking about. Whatever is your sanity, like playing games, watching shows and stuff. That is something I wish I had adopted. I'm gonna be honest, I have trouble doing that at times because I've got to keep up with my review, gotta do whatever. I tend to push off that like rest day. Stress builds up very like insidiously, and then when it gets to that point, we just like have like meltdowns and all that not fun stuff. Every so often we manage to like shave it back down to baseline. It prevents us from ever having like a major stress like burnout.
I'm a very goal-oriented person. Like if I want to do something, I really won't stop until I do it. And I'm usually like not satisfied with status quo. So I would continuously try to pick up more things to do, and I'd feel almost guilty to spend time on myself. Eventually you learn that it's tiring, and it's like the things that you used to feel you have passion for, you feel like you've lost that passion if you just continuously push yourself to do more. Sometimes it's not wrong to just take that day off for yourself. You don't have to always strive to do a lot.
YouTube is examples since people actually have context for it. But I think as you said, like everything I do, I feel like I always have to like make it excellent or like beyond excellent, which is not necessarily to show off, but just because like if I've committed to it, I'm putting my name on it. You never want to Chinese right now. My mom would say like half a tub of water effort, only go like full tub. And I think that's bad because then for example, there was a bit where I was like, I wanted to be super ambitious, and I was like, well, I should make all this series and try to, produce things twice a week or whatever. And I just got very like wanting to make it very, very good, which is fine. I think it's amazing that we have this drive to always strive for excellence and improve, because that makes things more fun when you want to make it like take it to the next level, and like instead of just like, oh, it's like that thing. But I realized that one of my friends gave me this advice, was that there's a difference between doing a poor job, like just because you were too lazy to put in like the effort, and then there's a difference between consciously choosing not to make everything into like a pursuit of like an Oscar type of like effort. that it's okay to that ultimately, for example, this is meant to be a hobby, a way to give back with the free time. It's not meant to create another stress. And just like, yeah, like to remind myself that's a choice, that it's okay to sometimes choose to be mediocre. I don't want to say choose to be mediocre, but choose to not be like, 110%.
Yeah.
Choose to be 75, but I struggle with it all the time. When is a good time to do the MCAT during pharmacy school?
So like the important thing about doing the MCAT is you need time to study for it. And unfortunately in pharmacy, every single summer you have practicums. So most people decide to do MCAT either in first or second year, because then your practicums are the shortest. In first year, you only have to do 1 month of practicums in summer. And then second year, you do a month and a half of practicums. But then in third year, you have to do 2 months. So that considerably takes away your time to study, considering on practicums, you're doing full-time rotations, right? Monday to Friday for 8 hours a day. So that's why I decided to do my MCAT in first year, and then study all through the summer, and then did the exam in August. And that was in summer of 2018. And I think the important thing is, like, if you know you're going to study for the MCAT, don't plan so many things in the summer to do. That was my mistake. Like that summer, I said I was going to study for the MCAT, but I thought it was okay that I could balance a whole bunch of other things on the table. So like that summer, I was working. I was doing full-time SSRP. I was balancing practicums. I was planning first-year orientations and studying on the MCAT on top of that. So that took away like a lot of my concentration, and that wasn't great. So, if you're going to do it in pharmacy, just dedicate a summer to study.
Mm-hmm. Yeah. For context, people don't know, every single thing that Wendy listed is actually a huge commitment on its own. So SSRP is a full-time job, my friends, and working is, and I was going to add that, I know, for example, when you're talking about your practicum, maybe someone who hasn't experienced it, it's, she says it's 8 to 5, but usually when you come home from a clinic, you're quite like beat. I don't know. I know.
Yes.
I think a lot of people feel that it's a little bit different from going to class. I wouldn't say going to class from 8 to 5 is tiring in its own way, but I think because you're on a professional game face, kind of when you're as a pharmacist,
Yeah.
you're every moment you're trying to be alert. You're also like paying like a lot of attention to your colleagues and your supervisors, so it drains you a little bit more. So it's a lot more exhausting. So those like 5 to 9 is a little bit, you're kind of a little bit lost in energy because of that's a bit more difficult than it is. So what would you have like reduced yourself down to, like if you got to like re-choose that summer?
It's hard to say because all those things were very important to me. But like if I had to pick, I would have just not worked that summer. I would have because I only worked once a week back then, I would have just not done that. SSRP was full-time, practicum was full-time, and then planning the orientation was a lot of hours as well on the side. So if I could spare any hours, I could. Like I would have. Stands for Summer Student Research Program. And in UBC, it's a special program where as an undergraduate, you can apply to do research under a professor or a postdoc or a PI. You can find them by yourself, or there's like people that post up their research projects that you can apply to. And if you get the chance, then you will be awarded like a certain amount of money, like grant, to do the research for a couple of months with the postdoc or the PI. But that requires a couple months of commitment. And first year practicum in pharmacy is 1 month. So then I think I did mine in May, and then I spent June and July in SSRP. And I think it was minimum of 2 months commitment. So that was basically what I did. So I was doing full time for 3 months. On top of working and everything else. I had more time to study in practicum than during SSRP because during practicum, first year was actually pretty chill. Most preceptors are very understanding of the fact that you learn a very limited amount of things in school. So you do most of your learning on the job. And then when I come home, I would just be able to study. But then in SSRP, there's a lot of things you have to prepare for, because I worked in a wet lab. So there were things I need to prepare for the next day, and as well as the last couple of months of summer is usually when I have to do more things for the planning of the orientation. So during the last couple of months summer, I would say I only got like maybe 1 or 2 hours of studying a night at most, because I need sleep. I am not a person that can be a night owl and stay up the whole night to study.
So I guess it sounded like you studied 3 months, 4 months?
Like 3 months, yeah.
And you're still
Yeah, it's manageable,
Mhm.
but I wouldn't suggest you do it.
But I find that really hard to answer when people say like, how long should I
Yeah.
study?
Mm-hmm.
Get that, and it's hard, and I wish there was an easy answer, because I wanted an easy answer when I was choosing like how long to study.
Mm,
But I think like I was similar to you. I think I was doing research at the same time, and I was
yeah.
like, this is not ideal, but you make it work. You just kind of juggle it, and you're like, I'll have to do this once, hopefully. Cross my fingers.
Yes. Yeah. Hopefully you have to do it once.
I think that's why I feel like mixed on too, because I think part of me was one time I was answering someone, I was like, oh, actually I would go back and for example, some of my friends just went 100% MCAT. Sometimes I feel tempted to recommend that, but I do think like doing research is such a fun, interesting activity, and I'm sure like doing orientation and like those are things that are actually very fun and enriching, and you're doing them because you love them. And
Mm-hmm.
I find it hard to blanket statement to say someone to go 100%, because I do think if I did 0% research, I might have felt less more.
Honestly, I'm the same. I'm not a person that can focus 100% of my energy into one thing. I like to have a variety in my life. And yeah, you're right. I don't think I would have been able to just quit everything and then focus on studying. I think I would have definitely had something to do on the side. I wouldn't have done as much things, but you're right. Research was so important to me. And I learned so much, and I got to know so many great people through that opportunity. I wouldn't give it up for the world. Yeah, so you're right, it's very individualized. You have to know what you need to be able to study well. I think for me, pressure was kind of needed to study, especially in the summer. So because I had so many things to do during the day, I knew I had to study at night. So it got me a lot more focused on my studying that way. Mm-hmm.
I guess that's like what they talk about, like Parkinson's law. Like once you fill it up, you got no choice, and you're actually less of a procrastinator. Thumbs up. Like, can you tell us about the research you did? Like,
Yeah.
research nerd,
Mm-hmm.
hearing like what kind of exciting findings people are up to.
Oh, of course. So that was the SSRP was based on like, it was in a lab that I volunteered there before. So I actually started volunteering there in second year of microbi, and then I got into pharmacy. And then the first year summer, I did the SSRP with the postdoc that I volunteered for. Mm-hmm. So the lab was was called Rossi Lab by the PI, because his last name was Rossi, and is in the Biomedical Research Center at UBC. And they focused on stem cell research. And I thought it was the coolest thing ever, because I don't know why I love working with mice so much. Like, it was my first experience in the wet lab, and I just found it so cool that they got to experiment with mice. I know that sounds kind of morbid, but I really enjoy learning about, the process that goes into, because it's actually such a rigorous process. The researchers have to plan from getting like the specific breeding and the generation of mice that they want, to be able to, in the end, harvest the muscle, and then to get the sample and do whatever data collection they need on it. It's a really long process, a very interesting thing to observe. And I think I didn't really have a project until the SSRP, but I was just mainly helping my postdoc, because she was doing more things on like eosinophils and fibroadipogenic stem cells, which short for FAP cells. They basically have different roles to play in cellular regeneration. So for example, if somebody has a heart attack, these FAP cells, they can differentiate into either like fiber or fat. And if it differentiates into fiber, then it's really bad for the muscle, because it's no longer as strong. There's less like ability for it to work. And so that's, after a heart attack, your heart always becomes weaker, because there's fiber that fills up that tissue. So they're like researching in ways on how to prevent that from happening, and just looking into cellular regeneration as a topic, I think was very interesting for me. And my subtopic, or like my project, was kind of a subtopic of my postdocs, where she asked me to like basically characterize the different cell types, and like how many cell types there were inside a damaged muscle. So like looking at the percentage of eosinophils compared to other cells, and their role in regeneration.
That actually sounds pretty cool.
Yeah. Thank you. Yeah, I thought it was super cool, and I loved working and being trained under her, because she did train me a lot. She was a very, very patient woman, because I was a very forgetful volunteer. I would always forget where things were and how to do things, but she was so kind. And I think that's why I think I had such a good time in the lab. Like, everyone there was amazing.
Aw, so yeah. And I think that's really important. I think, like, was this your first research experience?
Yes, that was my first research experience.
I think that's like totally understandable. Even someone as smart as Wendy, everyone's first time kind of sucks.
It does. I look back on it and I'm like, I feel so bad. I wish I was better at things. I just, yeah.
So I think that's probably how everyone feels about their first time. Like, I look back and I'm like, why was that so hard to understand? Like, you know, there's like that meme where it's like, you know, like someone tells you something 7 times and you're still like, I think that's the thing about research.
Everyone has that. Like, I don't know why. We're all just such noobs in the beginning.
It's like research is its own language almost.
Yeah.
Like, and its own, like, for example, and also each lab and each particular field is so different, right? Like, because I haven't done wet lab and I wasn't trained in microbiome, if you threw me into your lab, I'd be like, what do I do with these mice? Help. And so, like, for example, I don't know what you have now, but like, say if I threw you into some of the stuff I'm doing right now, and it's maybe like uber specialized, you'd be like, help. Experience, I think, because research is so niche. So I would definitely think if anyone was like in your shoes, where you were just like just finished your first year pharmacy, and then I think it's hard to like reconcile the fact that you already have like a year of pharmacy under your belt, 2 years of like microbiome, like you feel like you should know a lot of things.
Oh, you really don't. Yeah, exactly.
I think it's totally okay. It's okay that you don't. I don't think anyone expects you to, because like the person training you is a postdoc, so like, you know, they've done all these years and they like did their whole PhD in it. So like they had the time to do it. That said, be like Wendy and be grateful when people take the time to mentor you. I think that just makes all the difference. And something I try to like emphasize a lot is, I think getting a good research experience is not about the prestige of the lab. To be fair, I think there is prestigious labs. I just don't know them, maybe because I never cared. But I think I don't know how you would know if someone's a good mentor, but if there was a way that, for example, you know, Wendy, you were friends with Wendy and she had this experience, or, you know, you knew someone who had worked at that lab and just said the mentor was really great, really patient, very hands-on and helping you, I think that would be more meaningful than to like pick something that just like sounded good. But I think also I would take away from yours is like, I think like there's a difference, like, for example, like you want to choose something that like a research project sounds glamorous, but I think there's also huge benefit, like for like what you did was that you found this topic just so actually fascinating, and when you're talking about it, you're so passionate about it. That like I think that shows, and that probably motivated you to work. And I'm sure it will show if I were admissions committee. I have no affiliation to admissions, I don't actually know how they feel, but I would think theoretically if I were on a committee, I would feel that. I would feel it if someone like Wendy had actually really loved what she did and she felt like she had a good experience. I can feel the passion, as opposed to someone who got stuck in something they kind of hated. So I think that's something to consider. Like, you gotta like it, but you also have a chance to learn, and you also got to put in that work and get over that hump of feeling really awkward and dumb.
It's true. Yeah. Yeah, I think like everything you said is absolutely, like, I can relate to it 100%, and I agree. If I had to pick between getting like a very prestigious lab and getting a great mentor at another lab that was less prestigious, I would definitely pick the better mentor. Because they just make your whole time, like your whole experience, so much more worthwhile. And like in a prestigious lab, you might not be able to do as many things as you do in another lab. I was able to do a lot of things that, you know, my friends in other wet labs weren't allowed to do. Like, I did the whole entire process from harvesting the muscle to freezing it, and then cutting it on the cryostat, and then staining and microscopy. Like, I don't think every person in the wet lab has the same experience I did. I was lucky to do it because I had a great PI. So yeah, definitely, like, great PIs make all the difference.
Nice. Did you end up doing any further research after that, or?
No, I actually left and I told my postdoc about it way beforehand when I finished my SSRP, because I said when I got into pharmacy, I knew I probably wouldn't be able to stay in the wet lab for very long just because of the intensiveness of the program. And also I realized that, my future profession isn't going to be as closely related to wet labs anymore as it was back when I was in microbi.
Yeah.
So I told her what my goals were, and she completely understood. She was actually one of my references from ed. So we still keep in contact today, and it's great that, I had this experience, we got to know each other.
Mm-hmm. From your research experience, did you get any publications or presentations, and I guess how you wrote up your research on your application, if you felt like it made a big impact or not, and how you feel about the role of how the importance of doing research, I guess, as a pre-med?
Yeah, I would say, I applied twice for medicine. The first time I didn't have a lot of research experience other than the one that I just mentioned about. Mm-hmm. And for my time at the wet lab, I didn't have any publications. For the SSRP, we are required to write something up, but that's usually just a report of what you did for this summer. That's not a publication in a journal. I didn't do a formal presentation anywhere with it either. But as for the second time I applied, that was after I'd already finished my directed studies. And by then this was in pharmacy with another PI. I did do 2 presentations. Well, formal presentations. I did 1 oral and 1 poster presentation at 2 different conferences. And I was working on getting the paper published, but it wasn't published when I applied. Mm-hmm. So all I had was 2 presentations. That's it. Yeah. And I think it was important because it shows, I think, that at least you have an interest in clinical research and that you have the ability to present and to talk in front of a professional audience. Mm-hmm. And I think, that was one of the big things that changed from my first application to my second application. So I would say I think it's important, but I don't think you need to actually 5 publications. That sounds a little bit crazy unless you've been working extensively in research before you have applied. I think it's hard for any undergrad to have more than 1 or 2 publications before applying. So mm-hmm.
I think you and I would agree. I think there's controversial opinions, and my bias is obviously I like research.
Yes.
I personally advocate people trying it.
Mm-hmm.
I know some of my amazing and super talented classmates were just I hated research, would have never done it in undergrad. I personally felt like it became a passion, so I would have missed out on it if I never tried it. So I definitely hope people will try it. Try it. And I think, I don't want to get flack for saying this, but I personally like clinical research a little bit more.
Yeah.
And I think that doesn't mean that research is better. It's just that as a more clinically oriented people, we find clinically oriented research more interesting. So I might say if someone did basic science research and they didn't find it interesting, they didn't find it engaging, you might want to give it another try again in a more clinically oriented way. And you still might hate it maybe, but I have a feeling you might like it more because ultimately if you're not someone who loves the basic science research so much that you think you would rather do a PhD over doing an MD, it probably makes sense that maybe you are more drawn to clinically relevant or healthcare related stuff. Can I ask what you did for your directed studies?
My directed studies that I did in my second year of pharmacy at BGH, and that was with the antimicrobial stewardship program. And I was recruited basically to do chart review. It was a retrospective study, and they looked at the use of cefazolin. Cefazolin is a cephalosporin antibiotic, and it's a first generation. There's some controversy with using it in the penicillin allergic population, especially if they're anaphylactically allergic. So my research particularly had to do with using cefazolin with penicillin anaphylactic patients and looking at what their reaction was and whether or not there was a reaction at all. So the chart review went great. I learned a lot of things from it. If you haven't done chart review before, it sounds boring, but actually it's very cool reading people's charts. You get to learn a lot of cool stories. And so through that, my PIs were actually very supportive. My entire my project was part of a bigger project they were already working on because VGH had already changed the pre-printed orders to suggest cefazolin, basically, to the penicillin anaphylactic population. My work is just sort of a quality assurance for it.
Mm-hmm.
Yeah, and with that data, I was able to draft out a manuscript and then make a poster. I submitted that to a Canadian conference called AMI, and I presented that as an oral presentation, actually. And then I did, yeah, thank you. And then I did an oral presentation at Washington, DC, last year as well, for ID Week. Yeah.
Amazing. That sounds super fun. That sounds like really cool opportunity.
Oh, no, like I wouldn't have been able to have this experience if I didn't do clinical research. And then also I was very lucky to have such amazing PIs and who were very supportive of my learning and to give me these opportunities. So I would say for people who are hesitant on trying out research, there's no downside. You will always learn something. So just go for it.
That maybe there might be a perception that pharmacy profs might not help you as much.
The only part I slightly questioned was my who to choose as my academic reference. And so for those who have never applied before, you need 3 references in your application: an academic, professional, and service. So academic is usually someone who has taught you like some time in your life. Usually, yeah, it has to be university. But I think like the difficult part, like that was a difficult part, because in pharmacy, everybody that's teaching you is a pharmacist, and you feel kind of like you're betraying your profession if you ask a pharmacist to be a reference for med. And that was why I had to think about who I wanted to choose. But then I realized it was kind of a no-brainer, because if you chose to do directed studies, you could use a directed studies PI. And that was who I ultimately used. My PI is actually like, well, he does teach in pharmacy as like a guest lecturer for some courses, but he's not like an actual tenured professor or anything. But because he marked me for directed studies, he saw about my work ethic, my ability to like handle stress or like get things done. So he gave me a great reference, and I think very thankful for him to do that. The service and the professional reference is sort of easy to get. You don't have to worry too much about that. Professional can be anybody who's like seen you work in a professional area. And in my case, it was also research, but in this case, it was my wet lab PI. And my service reference was my manager at Savons, who I worked with already for a while, and like he saw how I was with patients. Service is basically like a lot of people use their volunteering supervisor or something. Just seeing how you work with people, how you handle difficult situations, people who can talk about you like that. So my manager was a great choice as well.
So it sounds like these are quite flexible. So like, for example, the service one, it's more, instead of saying community service, it's people oriented. So it could even be your paid work. It could be your volunteer work. Maybe it could have been academic if your other ones weren't already academic. Picture it, you could probably not go wrong, assuming that like every extracurricular you did, I don't know, maybe did you have anyone else that you were like you didn't end up adding, but you considered like asking for reference?
Not really, not in the case of a med application. I already had very like for sure people, and I was glad that I had those choices. Some people struggle to find a suitable one. I thought all of my references were pretty suited to what they were going to say. So I was lucky in that aspect. But I would say one important thing I think I learned just from experience is that it's always important to just ask the person that you're like looking for a reference if they can write a great reference for you, and not just if they could write a reference letter. Because like I think this really like deters people who may just be like, okay, yeah, I'll write you a reference letter, and they're not completely sure about you. Like I think it's better to ask around people and like ask them, would you be able to write me a great reference letter, instead of risking a bland letter from someone you thought that was originally the best fit. And I think like this can save you a lot of time down the road.
That is a really
I'm in stress.
I think that's a big thing for med school applications. You really shouldn't, and most applications don't let you see your own reference letter. Some writers may give it to you. They might print a copy just so you know what they wrote for funsies, but I don't think I have any copies. But I think that's like less common. So you do have to feel quite confident they're going to say good things about you.
Yes.
And I don't think anyone is malicious enough to say bad things about you. Unless there's only one like maybe exception, is that this is their first time ever writing a reference letter for anybody, and they don't understand maybe like the fact that they shouldn't write anything bad about you. But most people, especially if they're a professor and you know, maybe they had a few students that have gone and applied to medical school pharmacies and things like that, they do kind of know the process quite a bit, and they kind of know that you're supposed to highlight like strengths and stuff. So
yeah, I think it's important, you know, always to try to get someone who would be willing to write a personalized letter for you, or as personal as possible. Because like, as you said, if you ask like a professor who has already had many students who ask them for a reference letter, they might have a generic template that they use. So yeah, I think it's like, if you know them very well, I think it's fine, but like, just make sure that they'll be able to write things about you.
Studies, I think my academic letter must have been weak. I think I did ask a professor, but I think like that I had a class with didn't work with, and I think it probably could have been stronger. But yeah, for some reason I feel like I had 5 references, but I don't know why that is. Maybe that's because, so maybe, and I don't think this is the norm, nor do I necessarily think people should do it, but maybe that's just what happened. I think UBC wanted a certain type of person, but the other schools I applied to, so I also applied to the Ontario schools and I applied to the Calgary, I think they had a different requirement and they needed something very specific, and the ones that I used for UBC were not the same, and they wanted something different. So I think I had to pull something else that was totally different for some reason. So I would probably look into that. I think most people are probably going to be applying to UBC if they're thinking about going to UBC Pharmacy and then UBC Med, but just to like be aware of that. I think the more letters you can get, the better. But you do have a limit. Usually it's 3. I think most people.
Yeah, 3. You only need 3.
3 people that really like you.
Yes, that know you.
That know you, and that's really hard to achieve. I know. I like thinking like maybe that's one thing I'm a bit more antsy about going forward with CARMS is like, for example, right now, because we are in such big classes and stuff, I don't know if I can't say confidently that I have anyone that is gonna say like, yeah, this person's amazing. So I'm like, hopefully, I think it's definitely not the easiest thing to do. So yeah, do stuff that you maybe can interact with someone and kind of be a good person. And I want to say, I don't know, again, don't take my word for it, but I want to say if 2 of your letters are pretty good and one of them is like so, like maybe you only could ask a professor that kind of knows you, I think like sometimes you gotta play with what you get, and then if you don't get in that cycle, then maybe beat that one up. But
yeah.
But yeah, I guess to summarize what you said, basically being in pharmacy, actually you initially, I guess, is the perception of people on Reddit too, is that that maybe they would not like it, that you're, you know, in pharmacy, you're leaving the profession, but it's basically, from what you're saying, is like no one really cares. It's fine.
Well, I think like if you did like, sorry, I should have mentioned this before. Like if you did ask an academic professor, like someone who's taught you in lectures, it might be a little bit awkward to bring this situation up. I'm not really sure how they would take it. But like I think because my PI was a clinical, more of a clinical professor, I guess. So he works a lot with doctors and all the other healthcare professionals. So he didn't really see a difference between going into pharmacy and med, which I was actually very grateful about. You know, he's told me a lot about himself. He says he's actually considered med before when he was young, and he's really inspired me in a lot of ways. And yeah, he was very supportive of my decision. I was lucky in that way.
So I guess to change what I said is maybe there might be, maybe it might be awkward. And it's hard for you to say because you didn't end up having to ask to anyone. So maybe reinvestigate that, and maybe probably go by feel. I think it's probably different to approach a professor that you've only interacted with once or twice and be like, hey, I want to go to med school. Yeah. It's probably different that this person knows you, they know your intent, and they know you on a personal level, and they want to vouch for you. So probably anyone in whatever context, if they know you very personally and they know your passion, they probably will support you. And if I'm not sure. I'm not sure. This is a very good question that someone had asked, and I guess I don't know the answer. We don't know the
No,
answer.
I completely agree with you. I mean, like if you decide you wanted to ask a professor that you've never really even talked to, like in pharmacy, that you're going to go into med, you ask them for a reference letter. I don't think that's a good decision at all. If you know the professor personally, like if you've actually done research with them, and we do have tons of academic professors that actually do have students in their labs, like, and overall you've talked with them about it before, I don't see why they would say no. I really don't. Like, but don't just, approach a professor that you don't know very well about it in pharmacy.
Hmm. And I
Mm.
think probably what you did is you were respectful about like leaving pharmacy for medical school. I think I don't want to put anyone down, and I don't I don't want to say like this is wrong, but I do think, and I don't think the people make it that do this, is some people are very condescending about
Mhm.
pharmacy and treating medicine as superior. I
Yeah.
think, I guess for context, we got introduced by our mutual bestie Jamie, which I had some videos with, and I was like pointing, I don't know where they're gonna go, but check those ones out. But I think both of us, and I think a professor can tell. I think someone who has respect for like pharmacy itself as a profession. I think there is like, I think like the definition of like when people say like treating it as a stepping stone, like, I think in all fairness, in the literal sense, like it was kind of your stepping stone, right? But I think there's a difference in like the attitude of like what attitude are you treating it as a stepping stone? Are you
I
treating it
completely agree with that.
yeah, because like for example, you did have that interest of like pharmacy for the sake of pharmacy in a bit. And like I think you ultimately always knew you were interested in medicine, but I think there's like a difference between being arrogant about it, and there's a difference between being like, yeah, I tried it out and I still like, medicine still calls for me. I think people can tell that, and it probably shows. And I think if someone, say for example, you were working in like say your Safeway, and you were really like you were constantly being dismissive about the fact that you're in pharmacy and not taking your own responsibility, it would have been different. So I
Yeah.
think it's all about like work ethic and character in the end. I think there's like good karma, and like you do good, people recognize it.
Your attitude has a lot to do with things. When you mentioned sort of like the hierarchy thing, I'm going to say it does exist. Like there's still a lot of people, I wouldn't say like maybe like the newer generation, but I would say like maybe still some of the older generation may still feel like there is a distinction between pharmacists and doctors, and maybe perhaps pharmacy is always a level lower than that. But I like, I'm from personal experience and like shadowing a lot of pharmacists in the hospital. You see how closely the pharmacist and doctor works. And sometimes there's almost like the doctors trust pharmacists more than they trust themselves. They would ask the pharmacist recommendations all the time. Pharmacists write the orders for the patients and the doctor just signs the orders. So use like, for me, by that, because I got in third year, like during my third year practicum, I was honestly okay if I didn't get in. I would have had a great time, I think, if I applied to hospital and just like worked as a hospital pharmacist. I would have been totally fulfilled with that, because I think in the end, like my goal is to provide care for patients, and I could see myself do the same thing in hospital pharmacy. I would see no distinction, and I think that's how much I value the profession and how much my, I guess, previous assumption of only doctor exists in healthcare has changed. Yeah.
Yeah, I thought you put it so eloquently. I was like, I don't know what I can add, but I think that's exactly like that's what I mean by like you having that really like attitude. I'm sure that showed in your work, and like the amount of interest you were showing in your practicum and stuff. So and I think it's always good to have that attitude, to try to treat it as seriously as though you might consider actually doing it. You don't have to lie to people to say like that's like, if that's not actually what you want to do. But I think to treat it as seriously as though, like that's the advice people give us in clerkship, like say you always want to be a plastic surgeon, but you should treat your pediatric rotation with as much respect as though you're going to become a pediatrician. I think
Mhm.
that same philosophy applies, that if you're in pharmacy school, if you're doing nursing prior to med, I think if you treat it as seriously, you still, you want to go to pharmacy, but you're treating in that moment, you're training as though you want to be the best pharmacist, the best nurse you can possibly become. So I think same goes with research. If you're treating it with as much respect as you could potentially see yourself continuing on research, I think it will serve you well.
Yeah.
It will keep it more interesting too. Yeah, I think pharmacy is a really good one, and I think it's something that I think luckily around our school UBC, a lot of people, it's quite popular and it's growing. It's definitely growing in interest and getting more competitive in that way. But I think there's a lot of really great healthcare fields. This should be a different video, but I think even for myself, ironically, I know I'm being a hypocrite. I ended up in medicine, but I think for a lot of us, there are actually the people that are interested in healthcare, but medicine isn't so much your boat for a variety of reasons. There are actually a lot of allied health that are so incredibly valuable. And yes, in like med school too, they always talk about treating your pharmacist respect, that they're a good go-to resource if you want to know some details about interactions, about dosing, and really working together and respecting your team. Yeah, I don't know. I think I've been asked that too. Like, what do you think about like doctors being snobby to, pharmacists and stuff? I think, there's always bad apples. I blanket statement and say like our entire field is, perfect. But I think, there's nasty people in every field, and there's people who will look down on other professions in every single field. But most part, I think people try to be respectful, and I think the responsibilities are different. Just like you should never have a physician dispense because they won't know how to do it unless they were a prior pharmacist. It would be terrible for a pharmacist to do surgery. So I think everyone just knows knows where they should, what skills they have to provide, and then we work together. I think that's a tangent. That's a tangent, my friends. All right.
That's important. I think it was an important discussion, important tangent.
Yeah, no, I think that was a good one too, actually. That's the one that you brought up about like backup plans. That one is, I think, maybe for you and I is a little bit more obvious that we were applying in the middle of a degree program. I would have just continued and done another year of my undergrad degree and then figured things out from there, probably reapplied a few times. But you mentioned that you were going to consider hospital pharmacy. Was there any like other backup plans or anything that you were thinking of?
For me, not really. I think since I've entered pharmacy, I've already decided that I prefer the hospital environment more than the community environment. So if anything, if I didn't get into hospital residency the first year, I would have just worked as a community pharmacist, maybe as a floater for a year, and then reapply the next year. I think my ultimate goal would be to work in a hospital, whether as a pharmacist or as a doctor. So I would have worked hard until I got there.
Nice.
Mm-hmm.
I guess to give a plug for pharmacy, what are some of the like differences between pharmacy and medicine that I guess it's hard to say, you're not here yet, but you're soon to be here, but I guess from like your experience in the practicums and stuff.
Differences in school or as in clinical practice? Okay, so for people unfamiliar with the pharmacy profession, in Canada, you usually see pharmacists in two areas, in the community or in the hospital. Community pharmacists are the people who type up your prescriptions, dispense your drugs in like Shoppers or Save On, Safeway, etc. And then the hospital pharmacists are if you go in and the doctor writes your orders, the hospital pharmacists do dispense, but they also have to double check. Same thing as community pharmacists as well. They double check what the doctor has wrote, make sure that it's, the correct drug for whatever condition, correct dosage, make sure that it's available to have, all of that stuff, and then make sure you as a patient receive the med. And since the doctor is usually very busy, I think the pharmacist does have at least in some wards, because I did my hospital practicum in a surgery ward. The surgeons are almost never there to see the patients regularly, so the pharmacist and the nurse practitioner are the ones who basically run the ward, and they look after the patients very well. They have a lot of respect amongst the healthcare team, and they can do they interpret lab results, they can order certain things for the patient themselves as needed. So I think the only difference is that physicians diagnose. They look at the patient initially, come up with a problem, and the pharmacist then comes up with a solution either with the doctor or without. And then they talk about whether or not it's suitable, and then the solution is given to the patient. Yeah.
Nice. Sorry, that was an unexpected question, but
that's okay. It's basically pharmacists always downstream of the physician. You guys always, or doctors, well, you always look at the patient first.
Yeah, it's like a different point in the path, but
yeah,
I would say arguably a big level of responsibility in its own ways. yes, extracurriculars, we mentioned a bit about your research. You did mention kind of bits and pieces, but I guess this is where we tie it together.
Mm-hmm.
This is where I just was curious if you wanted. I usually find that people that love their extracurriculars just end up getting really passionate and telling us everything about like their projects and stuff. But this disclaimer that I'm going to start off with is that these are just for like inspiration, just to show by like say you're watching Wendy's video, you're gonna watch Kay Young's video, you watch Lynn's, you watch mine, whatever. All these extracurriculars are going to be different. There will be some similarities, I think, given that some of us also like went to the same institution and stuff. But I think it's really awesome to see that there's like diversity and nothing. You never have to do any of these things to get into medical school, nor will doing these necessarily get you into medical school. But hopefully these just provide some ideas and inspiration, and yeah, take us away.
Yeah, okay, sure. So as I mentioned before, pharmacy's intensive program. Don't force yourself to do a lot of extracurriculars. So I'm just talk about some of my experiences. So volunteering, I never did anything that was like typical, I guess, of a pre-med where I went to the hospital and I looked after patients and et cetera. Like I never did any of that. Actually, once I got into pharmacy, I stopped volunteering altogether. I only did, so in undergrad, I did do more. So I was chairing like a national nonprofit organization, or I was like BC chair. And it was for empowering high school students to pursue STEM fields. It's called Science Expo. But then unfortunately, because I knew I was going into an intensive program, I stepped down from that position and I moved on to pursue other things extracurricular wise. I would say like in pharmacy, I really enjoyed my time in the Pharmacy Undergraduate Society. So in second year, I was the secretary, and that was where I talked about planning first year orientation for incoming pharmacy students. This orientation is called GPA, which stands for Great Pharmacy Adventure. And it's a really, really fun event that all incoming students look forward to when they come into pharmacy, because for a lot of people it's their first time going to a professional school, and we have a brilliantly amazing building because it's very new and we hold a lot of like different stations in there, and it's sort of styled after the Amazing Race, and it takes a whole summer to plan. So I was chairing that as the secretary. And then in my third year of pharmacy, I became the vice president external for FUS, Pharmacy Undergraduate Society. And in there, I was like working very closely with AMS at UBC, which is the alma mater society. We discussed basically everything that's going on in the school. And I was also part of the health and dental committee, where we discuss and advocate for different health coverages for students. Other than that, I was also part of UBC Pharmacy Awareness Month. That's in March. And I was chairing that in my third year. So that's kind of an advocacy role for the pharmacy profession. As you could tell, I was very passionate about my role in pharmacy school. So like with my execs, we were able to like create like a month-long calendar of different kinds of events. It was eventually cut short by COVID, which was very unfortunate, but I really appreciated all the work that my team put in. And I think it would have been amazing once we got everything together. Otherwise, I was also part of like a small team that worked on a project for the British Columbia Pharmacy Association conference last year. And it was basically creating like an innovative service that pharmacists can implement for their patients. And we did something along depression and anxiety. So we used questionnaires such as PHQ 9 or the GAD-7, and we thought, oh, it might be possible for pharmacists to use those questionnaires to monitor their patients' mental stability. And so that was something that we did, and we got an award for that, and that was cool. Otherwise, research, I told you guys mostly everything. I think there was one other thing. I did a short work learn term last year summer as like they called it I don't remember exactly what the role was called, but I was working for the Canadian Pharmacogenomics Network for Drug Safety, CPNDS, in BC Children's Hospital. And it was very cool because it was my first experience in pharmacogenomics. And this was like a chance to learn about how researchers put together data from like adverse events of the patient and their genetics and be able to find a correlation together. And my like I was basically helping with a project that looked at like oncology drugs, a specific oncology drug and some specific adverse events. And then I was doing another chart review for them. That was a very interesting experience as well.
Ooh, that sounds fun.
Yeah.
So I guess I was to summarize. So we covered, like, we talked about volunteering. Correct me if I'm wrong. So volunteering, I think I like the fact that, for example, you mentioned that you actually didn't do any of the traditional stuff that people treat as though it's essential. I also didn't volunteer at a hospital. Y'all don't need to do it. It's a cool idea. I think it sounds really fun. I think if you've never had any opportunity to be in a healthcare environment, like, totally would be a cool place to dip your feet in. But from Wendy's story, like, you definitely don't have to have it. And I think that's, like, I think what you say, like, this is, like, I would say, if I would summarize Wendy's, like, flavor of extracurriculars, is it seems like you were very passionate. You did a lot of leadership, a lot of advocacy, and a lot of those are tied together. Like, you were in leadership positions to do advocacy work in a lot of committees, student council work, so a lot of collaborative leadership, and student government type of activities. So I think that's it. Does that sound right? Kind of your
I would say so.
The go-to stuff that seems to get you really excited. And I think that is, again, like, the point of why I bother to ask people about their extracurriculars, not for people to copy, but just to see, like, Wendy has this flavor, and Wendy's flavor is not the same as someone who did, like, a bajillion, like, service. Actually, I could probably compare mine, and yours is probably mine. As I actually did, I would say I did very little student government. I did a lot more. I didn't do, like, classic volunteering, but a lot more service and advocacy. So a different, like, blend. And I think they work just equally well. And it's all about, like, because I think, like, say Wendy and I end up in the same hospital, ward or something. We're in the same, or I don't know, right? But we're gonna take on a different role in the healthcare team, and say, like, Wendy is gonna take on more of the leadership, and theoretically upstate the ward, and, like, mine will maybe, like, every doctor is a different flavor themselves. Every specialty is different too. So I think no one's extracurricular blend has to be exactly what it is. But I think the other takeaway that Wendy, again, just as you were talking about all your research and stuff, is, like, again, you were doing things that you were getting excited talking about it and stuff. I think that's the goal, is you wanted to be able to, like, once you've done the extracurricular, you want to be able to look back and say, like, wow, that was, like, I still would have done that just for the sake of doing that, in a way. Like,
That's true.
There's always great to, I think there's, like, zero things wrong, but I'm going to try something out because I also need to fill out my resume for med school. Like, you got to do what you got to do. I think it's just nice to be able to do that as well as have a good time.
Yeah, I agree. Like, I think when I did these extracurriculars, I didn't think too much about what to put on the resume, but you're right. Like, I would be lying if I didn't think it would look nice on a resume. But I think most important is that, you're right. Like, I wouldn't ever, like, if I'd read this again, I would still do the same thing, just because of the entire community that I built, and I found throughout these experiences. Like, being in FUS gave me a whole family of people to connect to, and it was just, very. It made the whole professional program stress much easier to tolerate. Yeah.
We talked about research, volunteering. Did we talk about work or any other things?
Work-wise, I worked as a loyal pharmacy assistant for, like, basically all of my pharmacy years. I was working at London Drugs before for 2 years, and then I switched to Save-Ons last year. So I've been working at Save-Ons for a year and a little bit, I think. Yeah.
So yeah, I think that's the cool bonus, I guess, of you being in pharmacy school, is that you're also able to work in a healthcare environment. I would say with, like, a microbiology degree, I think that would be probably possible. You could, I'm sure I've heard of people still volunteer as, like, a pharmacy assistant, but I think you're a little bit more qualified, or maybe a lot more qualified, I don't know, to be one. And it kind of connects with your learning a little bit more if you're in a healthcare program. So I think that's another pro, I think, if I was considering doing pharmacy. Again, not the end of the world if you don't have it, but
definitely a plus, because, like, I think you just, like, as part of the like the healthcare continuity from the patient getting the prescription to you being able to give them their drugs, like, I think you just get to be a part of that journey for the patient. And for me, as a pharmacy student, compared to just another assistant without a pharmacy background, like you're able to understand the prescriptions a lot better, give the patient actual counseling. The pharmacists trust you a lot more, like maybe with typing up the prescriptions. And so you even get to talk to doctors a lot. And I wouldn't think, I would say that, you know, having this experience is a definite plus if you wanted to be in a healthcare profession.
Something I wonder would I have been better off if I had done something like nursing or pharmacy prior to medicine. I think that would have been very helpful, because I think the people in my class that were previous pharmacists, or at least have gone through pharmacy school, they're a lot more comfortable with some of the clinical things, at least at the beginning, compared to some of us. Definitely the nurses are, for sure. So I kind of have a bit of envy, almost, like I kind of, not envy, but I kind of wish I had a bit of that experience. Yeah, I think I think, again, there's like the pro and con is that on one hand you get that experience, but the price you had to pay was that it was a lot more work.
It's true, yeah.
So, you know, pros and cons. Cool. So I guess this one's just more fun stuff and just reflection. Is kind of the highest points of your journey, any favorite moments, opportunities?
Yeah. Okay. So I guess the highest point, or the thing that I enjoyed the most in pharmacy, was perhaps getting to go to the conferences that I mentioned about before. I just thought it was so cool. I never thought I would be able to attend a conference in undergrad or in pharmacy, just because I thought I'd never be able to be a part of a project that was going to be selected for one. And I think it was really like an eye-opening experience for me, because when like my first presentation was at AMU and it was like an oral presentation, I, like a second year pharmacy student, was like standing on a podium in front of like all doctors and like other healthcare professionals, like ID specialists. And I was like, I guess I'll talk. I feel so unqualified. But regardless, you know, it was very like, I would say, heartwarming effect, because all of the, you know, ID specialists didn't treat me like as if I was any different. They came up and asked me questions. I answered what I could, and what I didn't, I referred to my PIs. And it really got you feeling as a part of like a future healthcare practitioner. This is something that you will eventually be doing. And like that gave me a lot of confidence in my presentation skills. And later on, when I went to Washington to do the poster like presentation, I was like, this is nothing. I would have casual conversations with anybody that came over, and I think that gave me a lot of self-confidence. And I think that would say it's the most unique and highest point of my pharmacy experience. Point, I wouldn't say this one's about like, not my lowest point in pharmacy, but I guess just my lowest point in the process of getting into medicine is when I applied the first time and I got rejected. Like, it was actually really tough. I didn't think that I would be so sad over something, but I was very sad. Like, the first time I applied, I didn't even get an interview. So it just felt, it was almost like heartbreaking and soul crushing, because you basically spill out your life onto that application. And for people who have never applied before, it's a very strict application in that they list out like specific categories you can categorize all your experiences into, and then you have to describe them in a very limited amount of words. And so like when you are being so like honest and you try to say everything that you want to do, is very difficult. And when you pour out your life, you get rejected, your life like is reduced to a number, and that number is not good enough. Like, to me, I thought that was like a huge damage, like to my like self morale, I guess. And it was a deep funk for me. I would say I was in a very sad state for a while. But I think like how I got out of it was like, I just told myself that, you know, like I'm in a fortunate position that I could continuously reapply until I got in. And I don't think that, you know, like I would be too devastated not devastated. I don't think I would be sad at all if I just continued to do work as a pharmacist after graduation. The only reason I think why I continued to apply for medicine was just because it was just a dream that I always had. But there really reached a point where I wouldn't have found a difference working as a pharmacist or a doctor. Like, that was how I told myself. And I was very lucky in that I have a very supportive family and a group of friends that believed in me much more than I believed in myself. And I think that did give me a lot more confidence to reapply the second time, like obviously having some more new experiences, rewording everything. I think that does make a big difference. And yeah, but I did say that I do think that was perhaps my lowest point, just having to deal with failure like that. Yeah.
No, thank you so much for sharing that one. That one's like a hard one to share, so I appreciate it. I think it will be helpful because I think, as we know, the average applicant applies 3 times. So there are people that applied even more. So I definitely think like the takeaway from, Wendy's story is that like, even people that like, like you probably someone watching might be like, oh, like, before this point of story, they're like, Wendy had it all together. Obviously she was surefire to get in, and then, they feel bad about themselves, which I can imagine, myself doing that or something. It's just then, but realizing that like it's kind of a numbers game and it kind of sucks. And I think one of our admissions committee or something, they always talk about how, or maybe it was some other place anyways, they talk about how like they only have this number of seats, and they have basically of all the applicants if they took like double the number, every single like person, mostly like so many people that apply are like would have been amazing to take, but like, they just literally have a limitation of how big the class can be. And but I definitely I think that totally makes sense, because it feels a bit personal. It's like one thing to be rejected from something because of, I don't know, like something more like impersonal,
like grades or something,
yeah,
right?
if it was peer grades or something, right? Yeah, and you're like, but I think because you're like, I'm trying to showcase myself, it feels a little bit more of a personal attack. So I think maybe someone else can relate to your words and feel comforted by them. But
Yeah,
if
I
you,
would say, like for those who didn't get in, like don't even worry about it, because most of the time it's not you. Most of the time it's just the people that read your application. It's all very random, right? Like people who read your application might not relate to you as someone else who read your application might have. And so if you apply in a different year, like if you kept the application the same, there's no reason why like you won't have a different chance. And I think like sometimes it's just about rewording things, honestly. Like don't take it personally at all. Don't be like me.
but I think that's totally fair. So like I think like both be positive, like get yourself up, but I also think you have permission to wallow if you like, because
Yeah,
I think
sometimes that's needed.
you change. You mentioned like maybe you reworded stuff. Like what did you kind of revamp from second time to now successfully getting in?
I don't remember what exactly I revamped. I revamped my whole application. Like not the things like in it. I think I kept most of the things that was in my first application the same. I only changed the wording and I added new things. Like for example, the wording, instead of being a general description of what I did, a point that I got from my friend was try to make it quantifiable. Like I tried to add a lot more numbers, or try to like tell about the effect that I made instead of exactly what I did. Like for example, I would say I led a team of however many execs that created an event for however many attendees, and it was very successful because of whatever measure. So like it was kind of something like that, instead of just saying I led this and this is what happened. Like they don't want a description of whatever you did. They want to know why that was important. The new things, I would just say like I tried to add like, oh well, yeah, I put in my new research things. I put in a little bit more of my leadership things that I did in my second to third year. So yeah, I think that was basically it. Practicums help a lot actually, because you can put down your practicums as like patient interaction opportunities as well. So in pharmacy, like that's a given, right? That's a benefit you have, use it. So yeah.
Ooh, that's a nice hack. Yeah, I feel like definitely writing the application is an art. Maybe
Yes.
it should be that way, but I guess it is what it is. And it's kind of a weird way of writing. It's kind of like, most of us don't like sit around and like brag about our accomplishments in
Yeah.
numbers. So it feels weird to write about ourselves like that way. It's probably just like as many people, like if you haven't gotten to the stage of writing a medical school application, writing your resume is always a very weird experience.
Yeah.
Or a cover letter when you're like, I'm amazing because I did this, this, and this, and you're like, but it's a kind of like a learning experience, like how to write an application for sure. And I think like maybe like I guess I'm trying to straddle this takeaway is like both you managed to like get new things that improved your application, and I'm sure those like sounded really cool because now you have more healthcare experience, and then you also gain public the presentations and stuff, which are really impressive, right? I think the also thing was just like between the first application, second application, it's not like Wendy suddenly won like an Olympic medal, right? So like I think that's like maybe the key takeaway, again going back to our point about like that first time, like it wasn't that you were weak in the first moment, it was just like really maybe if you had applied with the same application, it might have with the reworded stuff, it maybe would have been the same. So it's nobody knows. I don't know what goes behind those like closed doors and stuff, but
just think like if you reapply next year, you have an entire year's worth to improve yourself and show them that you are an improved person. So I never think that like failure is, well, yeah, it hurts at the time, it does hurt a lot, but afterwards I think I was a better applicant definitely the second time.
Advice, or just basically words, advice, strategies you would have given to yourself when you were deciding whether or not to do pharmacy, or during coping with pharmacy school, or during the medical school application process?
It's weird because when you look back at yourself, you're like, I think I was the same person. I think I would have made the same decisions again. But now, like, there's a lot of things that change that you don't realize, I guess. Like, as I mentioned before, my third year of pharmacy, I really saw no difference between working as a pharmacist and a doctor. And when I applied, that was in second year summer, right? So you find out like basically a year later what the decision is. I was still leaning more towards med. But in third year really changed. So I guess like the advice that I would give back to my second year self when I reapplied was maybe you don't have to rush things. I wouldn't have minded getting my pharmacy degree before going into medicine. I think there's a lot of things I would have learned in my fourth year practicum that would have helped me in my future medicine career. Like, for example, like I already actually knew my placements for fourth year practicum. There were at VGH, St. Paul's Renal Unit, and my community was going to be in Campbell River. And I never, like, first of all, I've always wanted to go and work at VGH or St. Paul's. I've always wanted to go and like try what is like in more of a rural area like Campbell River and community. It was like my ideal practicum schedule too. So I think like, and now I don't have the opportunity to do it anymore because I chose med. So I think like, if anything, I would just go back and tell myself, don't beat yourself up by failing the first time. Doesn't mean that you're not good enough. You can become better by just waiting a little bit more. But it is what it is now, and I don't think I'll regret it. So.
And I think like that's probably like I totally relate so much to the stuff you said. But I think it comes from this thing that when we're type A and we have high expectations for ourselves, and we also put in all that effort, it is really easy because it felt like everything you did was your effort.
Yes.
That you can easily feel disappointed because it feels like, you pride yourself in effort. You're like, did I not put enough effort? Despite the fact, you put in a lot of effort. I think it's kind of, yeah. But yeah, no, I like that you put the positive spin that like you would have gained an experience. So like, I think that's really hard. And I think like, as much as I want to say this also to myself that was, in a similar shoes as you when I was in, that I think that those years that we go through an application cycle is always a very anxiety provoking year. I know some people manage to get through it very chill. Props to them. I wasn't one of them, but like that feeling that you wonder, like you really hope you get in, but you also keep telling yourself like, it's fine if it doesn't work out, it's fine if it doesn't work. I think obviously everyone who applies is very hopeful that it will be this year. So it's like that, it's like kind of a balance. And I definitely, I think it's someone watching this is going to be like, yeah, easy for you guys to say, you got to accept it, right? But like, I think it's, when I was, before I got in, people before me were telling me the same thing, like, don't rush. and I understand that now I'm repeating the same words. It's hard
Yeah.
to grasp in the moment because I think you always feel uneasy until you get there.
Mm-hmm.
But I understand, as from your story and you know, everyone else's, is just like that whole like that like rush thing that like, you know, like what was like the big, you know, like you're still like super young and have tons and tons of time to, you know, be a surgeon, be a physician, be, you know, anything, and, you know, crush these last, like, you know, this entire career ahead, and have so much to gain and stuff and so much to learn and explore. But I think it's easy to feel like, I always feel like it's easy to feel that feeling of always constantly feeling behind. I don't know
Yes.
if you feel that. It's funny because, you know, we're quite on track. And I don't remember this, I have to have my friends, as I have, same as you. I think the most thing I'm most grateful for, and I think anyone who's most grateful for is people that believe in you more than you believe yourself.
Yes. Oh my gosh. They're the sweet. They're the reason why you continue to be the way that you are.
I
Yeah.
think it really is helpful, especially people that are hard on themselves. But I think sometimes, even if you're not someone who's naturally hard on yourselves, maybe like Wendy and I think when you go through a trying time, not, you know, I wouldn't say this is like a tragedy, but I think a little bit where you are putting a lot of heart and soul and you can get quite crushed. I think having people by your side is like that, like really big thing that makes all that difference, that remind you that like there's like more life. And I think I have a friend that constantly reminds me that like I constantly complain about being behind in life compared to peers.
I get you. I get you.
Which is
Oh, I'm so sad.
maybe, I don't know, this is an off the mic chat, but
Like if I compare myself to my friends who are going to be graduating next year from pharmacy, like they're like, by the time that I graduate, which is in 4 years or so, and I finish residency, depending on what residency I do, it's going to be another 2 to 5 years. By the time that I get out, I can actually practice as a standing doctor. They're going to have like almost 10 years of experience over me, like clinical experience over me.
Isn't that so crazy? That's literally yes, exactly. That's what I mean by feeling behind, which sounds weird. Maybe it's funny because, again, I need someone who's not in this game to remind me that. But my friend, you know, you're technically, you know, I don't feel like a real doctor. I don't think I will until I'm done medical school residency and then being out in practice for a few years. But my friend was like, technically, you're kind of a baby doctor. To have someone that with that distance remind you that you're kind of on track, even though, I feel that like the people that are, or someone, I don't know if you had some friends that are like maybe already engineers, computer scientists, and they're like literally already drawing in like an adult, you know, adult salary, and probably on track if they save enough years to own their own home.
Like I have friends that have already bought their own apartments, that are already gonna get their, like they got their own mortgages and everything.
I want to say it's probably more common. There's a lot of people that are feeling like behind on, I think, the adultingness. I think that probably applies. I think if you go on and do a PhD or something, is to just anytime you're in like school for a protracted period,
there will have to be a sacrifice. So
it's a little bit, it's, I don't know, I wouldn't say, I don't think it's a bad cost, because in the end, like, if, you know, this is what I love, then I'm, you know, I'm happy to pay it, and it's fine, and I'm excited. I think the time that we're in training is fun. Learning, it's not like, you know, it's not a bad, it's kind of, it's a busy time, it's a rough time, but it's not a bad time. I think that's the thing. And I think like just that whole falling behind, and like financially, I think that's usually not the most biggest priority. I think it's just the feeling of being an adult and being like dependent on people and things, and because
it's not a great feeling.
I think like there is like that financial dependence a little bit. I'm, you know, happy to have my parents and stuff, but I think like there's a difference between when you're a student, you're always like looking up to you're gonna have a resident, you're gonna have an attending, you'll always be like the bottom of the totem pole, which is fine. But you know, by the time you like you said, like in 10 years time, our friends or people, our friends that are in pharmacy school or whatever, they'll already be managers maybe by the time you're just like coming out or still in training. It's a little bit of a weird thing. You have to be like, I don't think it's a bad thing. It's just like something that I just have to swallow some self-comparison, I think. But I think like in a few years, everyone's going to be getting married.
I'll be your bridesmaid, your bridesmaid, your bridesmaid. I'll go to your baby shower, your baby shower, your baby shower.
And then I think it's nice, but sometimes you know, if I'm in a good mood, it's cute, and then if I'm in a bad mood, it hurts. Where they're like,
Yeah, it does.
cool single aunt, the cool single child aunt, and I'm like, I know that was very well intended, but why does that hurt slightly?
I know.
What?
Like, I know you don't mean to attack me, but I attack myself.
That I wish I had is like that for anyone who's still pre-med, like maybe you have someone who has a lot of enthusiasm writing the MCAT, you know, before you did the MCAT, I mean, before you still got crushed slightly, or like you just got in that excitement. I think that's a really good time to, I don't know, you know, you could record yourself, you could write it. I think that's a really good time to record that enthusiasm, because I think you lose it a little bit.
Sad, but I think it's true.
It faded a little bit, so I think being able to remember and reflect on it. Both should leave questions for Wendy below, but I think Wendy answered a lot of them. And yeah, I think that's just like, you know, to summarize, there's a lot of pearls in this, and I probably will release like a big version, and then I'll also chop them too.
Sure.
But like definitely like some of the takeaways that we talked about was about the pharmacy to med school. It worked out really for you, and you felt like you shared a lot of different pros of it in terms of extracurriculars, but also yeah, just like, you know, getting good, you know, cool research or interesting things that you got involved in, and then also just like you had a good time with the extracurriculars that were related to pharmacy that you did. And I think one of the most powerful moments that you shared with us was like talking about like picking yourself up after a rejection, which I think it will be a common experience for a lot of people.
I hope what I talked about today is relatable to some people, can help some people, and yeah, thank you for having me here and to give me the opportunity to talk about it.
Yeah, no, thank you so much, Wendy.